Magandang araw po sa lahat. My name is Martha Umali and I will be sharing with you about palliative, hospice, and bereavement care programs and services. For my disclosures, here are my professional and organizational memberships and institutional affiliations. I have no conflict of interest to disclose. For this session, our objectives are the following: to review the essentials of the palliative care approach, identify those needing palliative care services, discuss palliative, hospice, and bereavement care programs and services, and recognize available palliative care programs and services in the country and how to be part of the palliative care community. Palliative care has been recognized to be an essential part of care for patients and families dealing with life-threatening illnesses. As defined by the WHO, it is an approach that improves the quality of life through the prevention and relief of suffering that may be due to pain or other problems, physical, psychosocial, and spiritual. For children, it is further defined as the active total care of the child's body, mind, and spirit, and also involves giving support to the family. So who needs palliative care? Adults and children with their families who are dealing with illnesses that are chronic, progressive, and life-limiting, far advanced and at the end stage, or possibly life-threatening, would greatly benefit from palliative care services. These conditions include cardiovascular diseases, cancer, chronic respiratory diseases, metabolic conditions such as diabetes, kidney failure, chronic liver disease, neurologic diseases, congenital anomalies, and infections such as HIV/AIDS, tuberculosis, and until recently, COVID-19, particularly those with moderate to critical illness. This is also part of the integration of palliative care in humanitarian emergencies and other crises such as in pandemics. The same conditions are also reflected in our Philippine statistics data. Out of the 620,414 registered deaths in the year 2019, cardiovascular diseases, respiratory diseases, and cancer are the top 3 causes of mortality in the Philippines. Of these deaths, only 58.8% were attended to by a physician or health officer. The majority, at 50%, occurred at home. These data imply a lot about the palliative care programs and services that our country needs to develop and provide. Palliative care spans the entire course of the illness, starting at the diagnosis until after the patient's death during the bereavement period of the family. Its framework is multidimensional and comprehensive, such that the care is continuous across all settings, including at home. Before identifying the needed palliative care services, the goals and intent of management and care must first be established. It must be clear with everyone whether the plan is for curative management with palliative care, for hospice care, or for terminal and bereavement care. Curative management with palliative care is recommended earlier in the course, even at the diagnosis of the illness, and the goal is for cure, prolongation of life, and support for the family. On the other hand, hospice care is recommended when cure is not possible, or definitive treatment is no longer desired or beneficial. With hospice care, which is part of the spectrum of palliative care and upholds its general approach, the goal is mainly improvement of the quality of life of the patient and their family. Though many times there is a positive influence and outcome in hospice care, such that there is apparent prolongation of life compared to what was initially expected. Terminal and bereavement care is provided at the start of an imminently dying person's terminal phase, and the goal is to maintain the person's dignity, comfort, autonomy, and control as possible until death, and during the bereavement period for the family to adjust and cope well with the loss of their loved one. The use of the term end-of-life care is widespread. It is the care given for persons with possibly limited months, weeks, or days to live. Since it may pertain to hospice care or terminal care, these terms are better and more practical to use. So again, the goals and intent of management and care must be established first to determine the palliative care services that would be provided. So what are the palliative care services that may be offered? Considering the multidimensional and comprehensive palliative care approach, these are disease management or co-management, services to address the different aspects of care that include the physical, psychological, social, practical, and spiritual aspects, and terminal and bereavement care when it gets to that point that those are needed. For disease management or co-management, services include supportive care, assistance with disclosures of diagnosis and prognosis, and care planning with the healthcare team through multidisciplinary conferences and family meetings. For the physical aspect, services are primarily for pain and symptom management, which is a very important aspect of care since pain and symptoms such as fatigue and difficulty breathing are some of the most frequent and serious symptoms and causes of suffering experienced by patients that need palliative care. For the psychological aspect, any team member may be able to provide some support, but for those with complicated issues and conditions, counseling and treatment may be required. For the social aspect, primary would be family and social support. One of the most challenging parts is the financial considerations. There are also daycare services and support groups that may be of help. Practical aspects of care include caregiving support, transition care, home care support, and visits, among others. For spiritual care, the palliative care programs and teams may include chaplains and spiritual counselors or refer to them. In terminal care, advanced care planning is essential. Care for the dying may be arranged in a palliative and hospice care facility or home hospice based on the preferred place of care. Some of the bereavement care programs and services include memorials, grief recovery support, and therapy as needed. The WHO Guide on Planning and Implementing Palliative Care Services referred to this adaptation of these categories of palliative care services, namely palliative care approach, general palliative care with specialist support, and specialist palliative care, which may be provided in acute, long-term, or home care settings. Palliative care approach may be practiced by general practitioners or family physicians, community nursing teams, in nursing and residential homes, and in the hospital. General palliative care with specialist support may be rendered by volunteer hospice services, home palliative care teams, and hospital palliative care support teams. For specialist palliative care, services are provided by home palliative care teams, in daycare centers, in inpatient hospice, and in palliative care units. So what are the eligibility criteria for hospice care programs and services? A prognosis of 6 months or less with a natural course of the life-limiting illness or frequent hospitalizations in the past 6 months are the general eligibility criteria. Other criteria may be one or a combination of the following: changes in cognitive and functional abilities, compromised activities of daily living or ADLs, such as eating, bathing, dressing, transferring, or walking and moving around, toileting and continence, deteriorating mental abilities, specific decline in condition, increase or progression of symptoms, particularly weight loss, weakness, fatigue, or somnolence, recurrent infections, or skin breakdown. These are the types or levels of hospice care. Level 1 is routine home hospice care, which may be provided in the patient's homes or in long-term care facilities and nursing homes, or wherever the place that is most comfortable for the patient. Then there are provisions for visits and other services, and 24/7 palliative care services, which provide support for the patient as well as for the family and caregivers. The hospice care team may also assist with transition care by providing care instructions and assistance with the preparation of needs such as equipment. Level 2 is continuous home care, which is basically hospice care in 24 hours a day. Level 3 is general inpatient hospice care. This is admission in inpatient hospice units or special arrangements at other local facilities for around-the-clock care until the patient can return home. Level 4 hospice care is respite care. With this, patients are admitted to an institutional setting for a limited number of days to allow brief respite for the patient's primary or other caregivers as well. Bereavement care actually starts at the recognition of the imminent death of the patient. Most of the time, there is normal grief reactions considering that these patients are diagnosed with a serious illness that is possibly life-threatening. Bereavement care programs and services vary, but generally includes memorial programs, grief recovery support, and grief therapy for those experiencing complicated grief. Memorial programs may provide bereavement care at specified periods as the bereaved family goes through their journey of mourning for the loss of their loved one. Grief recovery support is a general bereavement care and support that involves grief assessments and provision of the corresponding support needs of the bereaved family. Grief therapy may be needed for those experiencing complicated grief. These may be individual or group therapy with the family or with others who are experiencing the same issues and difficulties. Palliative care teams include a combination of physicians, nurses, social workers, psychologists, allied health professionals, dietitians, pharmacists, home health aides, spiritual counselors, bereavement counselors, volunteers, and among others. There would be different members depending on the programs and services and the needs of the patient and family who are at the center of the team. Multidisciplinary conferences and palliative care team meetings are regularly done to discuss specific goals, management, and care plans. So where are palliative care services available? The Philippines is categorized as a country in Group 3 on the four-part topology developed by the International Observatory on End-of-Life Care, having only localized palliative care provision. For now, services are mainly dependent on the availability of palliative care providers, among other considerations. Some of the considerations to palliative care development include government support, policies for palliative and hospice care, and related regulations, standards and guidelines for palliative and hospice care, training and capacity building of palliative care specialists and providers, resources and financial considerations, and professional and public awareness and acceptance. It's good that palliative care is now being recognized as an essential part of our health system with its inclusion in the plans for universal healthcare in the Philippines. Palliative care is an important part of family and community medicine practice. Proof of this are the various palliative care programs in which family physicians and primary and community physicians play significant roles from its development, management, and service provision, and the inclusion of palliative care in the core foundation courses in family and community medicine residency training programs. Palliative care is also ingrained in our family medicine principles and communication skills, in community-oriented primary care, and in EBM research and quality assurance training and practice. For specialist palliative care and support, the Philippine Society of Hospice and Palliative Medicine is a growing community with a mission to promote and advocate for easily accessible, timely, and high-quality palliative care and its delivery to all patients with serious life-limiting illnesses and to their families. Our PSHP and fellows and members and their affiliations may be found on the website as well as other useful palliative care resources and opportunities to become a palliative care provider and advocate. Sharing with you these photos from our past annual conventions that were attended by a growing palliative care community that is working towards comprehensive palliative care programs and services that are integrated into our health system. With that, maraming salamat po. Have a good day to all and stay healthy.